So today we're going to be injecting a filler called BellaFill. It's more of a permanent filler that auto-stimulates collagen in the patient's body. And we like to use this filler in areas of volume loss. Some of the most common areas of volume loss are the temple area, where we lose the temporal fat pad, in front of the ear, at the lateral orbit, and the nasolabial folds down into the pre-gel sulcus. And as you can see on this patient, she's lost some volume in the forehead, the temples, lateral orbit, and in front of the ear, as well as the nasolabial fold. So she's an excellent candidate for BellaFill. The beauty of this product is it really lasts a long time because we are auto-stimulating collagen in the patient's body. They're able to maintain it for a long time. One of the things we really like to do at Torrey Dermatology is keep our patients comfortable. So we're thinking of all kinds of different ways we can do that. This patient has had her numbing on for about an hour prior to coming in today, so she's fully numb and ready to go for this procedure. In addition, we're going to be using the Zimmer, and you can see Maria's holding the Zimmer. That's cold air that we blow onto the skin to numb the skin before we put the needle in. And when we're filling the temples, we want to just fill to the point of full correction. We don't want to overfill. Okay, so we're going to be coming into the lateral side, under the cheekbone, giving her a little bit more volume in this area where she's lost some. We always want to kind of distract the skin. We do that just by pressure and by using the Zimmer. You can see that there's a little bit of loss of volume in front of the ear and along the lateral jawline, and when that happens, the skin tends to drape downward and you get a little bit of a jowl in this area. So what we're trying to do today is restore a little bit of volume to the lateral jawline in front of the ear, which will give her a lift along the jawline and, in fact, even on the neck. So we'll go ahead and inject a little BellaFill in these areas. And one thing that we talk to patients a lot about when it comes to filling is that we don't necessarily just fill up an area that looks like it's sagging. We oftentimes go either lateral or superior to it, because that's how you're going to get more of a natural lift. You can see that she really has some nice volume back now in the lateral lower jawline. And a little bit more of a pull here. So she has less wrinkling medially because we've given her volume back laterally. And then she even has a little lift on her neck there, if you can see here, just simply by putting some filler in the lateral jawline. So that was a really nice effect. The last area we're going to inject is her nasolabial fold into her pre-gel sulcus. And you can see, if you do this to the skin, you can see that there's a little bit of volume loss right here, and that's very typical for that area. So we'll want to make sure that we get into this area as well. Giving her a little bit more of a platform around the downturn of the mouth so we can get that to rise up again. So we've now completed the left side of her face. Okay, so we're going to do the same thing on the right side. We're going to give her back a little volume in this area where she's lost volume. Her little bit of a jowl here is going to be lifted because of that, as will her neck. Absolutely beautiful. Wow. What a nice change. Very good.